Hello. Today we'll be reviewing how to go about predicting diabetes with the screening tool. This presentation was prepared as part of the HAP 671 course taught by Saikiran at George Mason University Department of Health Administration and Policy. As an overview of diabetes, diabetes refers to a group of diseases that affect how your body uses blood sugar or glucose. Glucose is vital to your health and it is an important source of energy. The underlying cause of diabetes varies by type, but no matter what type of diabetes one has, it can lead to excess sugar in your blood. Too much sugar in your blood can lead to serious health problems. If undiagnosed and uncontrolled, diabetes can damage your heart, blood vessels, eyes, kidneys, and nerves. In addition, according to the American Diabetes Association, in 2018, of the 34.2 million adults with diabetes, 26.8 million were diagnosed and 7.3 million were undiagnosed. The size of the data includes over 800,000 unique patients and total records is over 14 million. Also noting, the data is simulated data from a major healthcare institution in the United States. In this project, one could use the CSS codes for defining diabetes. The CSS code provide information that maps diabetes ICD-9 versus non-diabetes ICD-9 codes. As far as predictors, diabetes was examined using its association with other health conditions. The dataset had thousands of ICD-9 codes, and of those codes, over 5,000 ICD-9 codes were identified as being repeated at least 29 times or higher. Another predictor included age. If there was a value of age noted in the data, that meant there was evidence of diabetes, and if a patient was noted as null in the age column, that meant the patient was not diagnosed nor treated for diabetes. Obvious predictors are noted as ICD-9 codes that occur often with diabetes, which means there were certain diseases with a high association of occurring together. A few examples of obvious predictors includes, but is not limited to, hypertension, gastroesophageal reflux disease, poisoning by insulins, and background diabetic retinopathy. The top 10 rare diseases that are predictive or diagnoses that occur more than 29 times, but less than other diagnoses are noted. A few examples include a thromboembolism of lower extremity, other general medical examination for administrative purposes, and late effect of fracture of neck of femur. Examples of 10 most predictive diagnoses that are not obvious are shown and includes but not limited to obstruction of bile duct, neuromyelitis optica, and ulcer of calf. Taking the likelihood ratios that were calculated for each diagnosis, we plug them into a naive Bayes formula to predict if a patient has or does not have diabetes. Naive Bayes makes no assumptions if one diagnosis or not has more of a likelihood of causing a condition as opposed to a different diagnosis. Also, naive Bayes assumes a predictive condition occurs as a product of likelihood ratios of each of the total number of predictors regarding a patient. The odds of a patient having diabetes is the product of each of the likelihood ratios associated with each of the ICD-9 codes attached to the patient. I use naive Bayes to calculate odds on if a patient has diabetes or not. A sample patient was chosen, and 5 diagnoses are noted along with their likelihood ratios in bold. All 5 likelihood ratios were multiplied and then divided by 1 minus the probability, which resulted in an odds of diabetes of 0.027. Using the dataset provided, a randomly generated number was assigned to each patient ID, in which 80% of the data was identified as a training dataset, while the remaining 20% was used as the validation dataset. Note that the obvious predictors or specific ICD-9 codes related to diabetes were not included, all while the predictors that occur after diabetes were ignored. The receiver operating curve, or ROC, is used to determine accuracy. ROC is determined by plotting sensitivity and 1 minus specificity. The area is also calculated, and anything over 0.5 is better than random guessing. Using electronic health record to create screening models is beneficial in determining patients with high and low risk factors of developing diabetes. Medical clinicians can better assess patients that have high risks and better help manage their medical condition of diabetes. All references used are listed. Thanks for watching.